Welcome to the Healthcare Webinar Series. Our first topic is mental health in context, and we are excited to interview Mr. Kevin Peter from Softmind India today. According to Hindustan Times, July 2020, India is staring at a mental health crisis, and for a country that continues to experience poverty and inequality with a significant increase in depression and anxiety, a pandemic is the perfect storm. Mental health professionals around the world are providing community support, and Softmind continues to play a crucial role in the southern part of India. Softmind India has gradually evolved into one of the few specialized mental health care hospitals, focusing on providing various clinical psychological services, hypnotherapy, and delivers online certification courses that are accredited to the Ministry of Health and Family Welfare in India. With a hospital in Kochi and various clinics spread across Kerala, Softmind has come a long way since 2002. Kevin, welcome.
Yeah.
You are.
Thank you, Apajita.
So you are a consultant psychologist at Softmind, a psychotherapist, and a CBT practitioner. Your areas of specialization include treating DSM-5 categorized personality disorders with a focus on depression, anxiety-related disorders, relationship issues and trauma, including ones related to the exploration of identity and life transitions. You also employ an integrated approach and use various psychological modalities to suit the needs of your clients. And with so many livelihoods at stake and the looming uncertainty that is becoming the new normal, how has Softmind responded to clients from the time when India announced its lockdown in early March? Over to you, Kevin.
Right. Before we start, thank you, Apajita. Thank you, Astrit, for having me here. And it's an interesting question that you brought up. And I almost don't want to use the word unprecedented, but it has been used and overused a lot over these past few months. But I have to use it. Everything has been unprecedented. What we are going through, what has happened in the past, the lockdown that you brought up, and since it was announced in a very diplomatic, democratic manner, well thought out manner, it left us with a situation in which we were in the middle of treatments. We were in the middle of offering treatments, charting out, planning therapeutic interventions, and suddenly overnight, none of us could go out of our homes. Even us being mental health professionals, it didn't matter. We were stuck at home. The patients were stuck at home, and it was all of a sudden the treatments had to be stopped, and then we had to go around trying to devise ways in which we could find a way around it, in a way which we could still offer treatments to the patients without the patients actually visiting the hospital. And so obviously we moved on to the telemedicine platform. We moved on to online platforms. And that also brought up various challenges. Then the challenge was trying to figure out which platform, which medium to use, and which would be more beneficial and which would be more easy to use. And then the challenges kept on arising. Were the clients ready and willing to use such platforms? Were they literate enough, like computer literate enough to use such platforms? And then there were also the technical issues, the internet issues, the bandwidth issues. And so the lockdown brought with it a lot of issues, but eventually we found a way around it. We started offering classes online, and we all started offering treatments online, therapy online. So that's how we overcame that challenge. Apajita.
Great. I'm aware of the classes being offered online because our CEO has recently completed one of your certification courses. We're probably going to talk about that later on in the interview.
Yes.
So moving on, with studies suggesting that during the COVID-19 and especially with the work from home routine, regular people are exposed to extraordinary situations, like you just mentioned, and are showing transitory and mild symptoms such as sleep disturbances, appetite disturbances, mood disorders, panic attacks, and anxieties. So we'd like to understand what kind of mental health concerns did the wider community face and still continue to face during the course of the pandemic. I mean, you've explained a little bit in terms of the kind of operational issues and it's just the kind of anxieties that the your clients were facing. But I'd just like to know a little bit more about what kind of cases, if I can use that term, did you sort of uh, experience or did you confront the most during the
There's always anxiety around. Anxiety is like one of the most common cases, illnesses, ailments that one finds in the society. I would go as far as to say that around 5 to 10% of the population suffers from anxiety in one form or the other, in varying degrees, of course. But so anxiety has always been a constant threat, if I can call it that.
Mhm.
And the issue that we sort of face right now is some people are way less anxious and some people are way too anxious about it. The less anxious types are the ones you find on the streets with their masks and don't pay too much heed to it. So that's the category of people with very little anxiety in them. And then the other extreme of it, people who are too anxious, who are always constantly worried about the COVID situation, the coronavirus. And I often say this to my clients that some stress is good. Some stress, having some anxiety, is the impetus, the force that drives you, that it gives you sort of motivation to overcome certain such challenges. So you need some anxiety in life, but once it starts becoming a situation where you start avoiding certain things, start putting a hold, putting your life on pause because your anxiety is so debilitating, then yeah, it becomes an issue, it becomes an ailment. So that's issue with anxiety. Like I said, it's one of the most common ailments that we used to face earlier, and the intensity of it has only exponentially increased over time since the lockdown and the opening up of everything. And from the soft minds perspective, what we try and do is we try and educate people. We educate people, we let them know that coronavirus needn't be, the COVID-19 situation needn't be focused and read like how one would do with football scores or the scores of a cricket match. You don't need to check the news every 5 minutes, right? And if you do end up checking, use proper reliable sources. Go to Center for Disease Controls, the CDC, the World Health Organization, WHO. Or if you want to prefer, stick to Indian institutions, there's the Indian Council of Medical Research, the ICMR, and then there's IMA, the Indian Medical Association. So stick to reliable sources for your information. Facebook isn't one. Facebook isn't where you should be getting news about coronavirus. Neither is WhatsApp forwards and definitely not Twitter. So that's how we've been educating people, like compartmentalize, make sure the news you're getting it is from the right sources, and also don't check it every 5 minutes. Olden times, news was a 30-minute program, everything news. Don't have to read up on stuff every 5 minutes. Wait till the end of the day, just glance through it, and then be done with it. Right.
Right, great. Even during the actually during the lockdown, because obviously right now it's lifted. We can literally say that India is no longer in its lockdown phase. There are varying opinions about whether that's a good thing or bad thing in certain areas. But just as I was going through it, that as is, India reported 134,516 suicides in 2018. However, the actual number may be far greater. And these statistics are more likely to witness a significant increase during and after the lockdown, as the economy dwindles and there's a loss of employment. Couple that with a lack of skilled mental health care professionals in the country, it pretty much makes it harder for people in need So have you
Mm.
faced any cases in the last couple of months where it's been that extreme, where people have been driven to take their lives out of psychological severity? And how have, if at all, how has Softmind intervened in those cases?
Yeah. Right, Abhijit. I'll answer that in two parts. First of all, I haven't dealt with a case like that. We haven't faced a situation with either of the clients we were seeing or are currently seeing. But just talking about suicide, it has always been a problem with us. I'm talking about the country. Suicide has always been a great issue in India. And we also have been in denial in a way about suicide and the associated mental health issues, the underlying issues, the comorbidities. We often, if someone dies of, if someone kills themselves, we often associate it with drugs and what the boyfriend or the girlfriend did and what they didn't do, rather than accepting the big elephant in the room, which is mental illness. So there's denial over there, and just talking about as a hospital. And what we did also goes against the tenets laid down by Western psychology, and it often talks about laying proper boundaries and making sure there's proper termination of sessions, and all of this is done to ensure that counter transference, these things don't happen, that the therapist does not end up being a friend. So ignoring all that, we what we did was at the hospital, we used to phone the client. Even if they had ended a session with us, even if they had ended treatment with us, we would phone them and we would just inquire. We would just like, hello, how are you? How's your health? So just basic human-to-human contact interactions, that has helped. And we also would just write to them, email them, just keep in touch. Again, not being a friend, but just during these times, just inquiring, asking, how are you? How is your health? I've seen that it has helped. People like interactions, people like the social bond. And the hospital, through these interventions, has managed to make sure that these times. So, in a way, I don't know, I'm not claiming that this has helped prevention of suicide. That would be too high of a claim, but uh, this has certainly contributed, I would assume, right?
Yeah, just straying a little bit away from the pandemic and coronavirus. We'll get back to that again in the next question.
Yeah.
But just in relation to suicides and the mental health
Mm,
situation in India, so it's still a taboo. I wouldn't be
mm,
exaggerating the claim if we say that talking about mental health care is definitely a taboo in India, specifically in certain parts where
mm,
it's not
mm,
really understood that well by the community and
mm,
again with the lack of the awareness it's always looked upon with a
mm,
frown and individuals
mm,
experiencing exceptional situations is that the way it kind of still
mm, mm, mm.
persists in the country
So I missed the last part.
is that the way kind of it's viewed in the country where it's still a taboo and it's not something that you discuss openly and then it's not really
Yeah.
associated with your
Mm,
normal physical ailments and etc. So you can definitely open up and
yeah.
discuss about
Yeah.
cancer or other um,
Mm,
you know
yeah. Of course. Of
ailments,
course.
but when it comes to mental health
Mm,
issues,
mm.
it's still a massive taboo in the country. Would you say that's a fair claim?
It is. It is. Uh, of course, I completely agree with you. It is still a taboo, and like you said, with certain ailments, with cancer, or it could be anything. It could be simply a tummy ache. I could openly talk about it. If I'm having a tummy ache, I could call in sick at work, tell
Mm.
them I have this issue, I cannot come in, and it's perfectly okay. It's understandable. Uh, Most people would say, take rest, take a medicine, get well soon, come in tomorrow. But what if I wake up from the bed and I don't feel it? I just don't feel like getting up. I don't feel the mood. I don't feel like taking a shower. Not really the excuses one can phone in and tell your boss. I just don't feel like coming in. I don't have the mood. It's not understood. They will never tell you, oh, is that it? Maybe you're burnt out. Maybe you're under stress. Maybe just take a day off. So yeah, there's taboo. There's not enough information. People are not educated enough about mental health as a whole. So definitely, it's a ongoing issue.
Right, right. So moving to our next question, and the situation is probably worse for members of the vulnerable and marginalized segments of India.
Mm,
And this comes at a time
yeah.
when India really needs to increase access to the first psychological counseling response teams with adequate training to deal with the shortage, in a limited time frame. Um,
Mm-mm.
do you think the marginalized community, such as the LGBTQ, perhaps the elderly as well, have been more
Mm.
adversely impacted by the pandemic?
I would say so, Apajit. I can't speak on behalf of the entire community because no community is homogeneous. So I can't
Mhm,
speak on behalf of the entire queer community, but I have spoken to a few individuals, spoken to a few uh, gay people, people who identify themselves as gay,
mhm,
and a few issues that they brought up was that since they haven't officially come out yet, and suddenly because of the lockdown they have been forced to sort of live away from their partners, and they have no proper means of getting in touch with them or going out to meet them without letting the world know that they are. Spoken to a few trans women, and they were, before the lockdown happened, before the pandemic happened, they were part of like the entertainment industry.
mhm,
And since the lockdown, the entertainment industry has been pretty much shut down. And I spoke to them, and they told me how the situation is really dire, and they were even contemplating turning to prostitution to fend for themselves, which is really unfortunate. So definitely the marginalized community, be it any way, the gender communities, the sexual orientation wise, age wise, the economic wise, the religion wise, it's always the marginalized community that faces the brunt of it. And a slight caveat too, because at the end of the day, all these communities get talked about, but a section within the our society, the middle class, the ubiquitous middle class,
mhm.
they no one almost talks about them, and they all have also been facing the brunt of it: pay cuts, job losses, stresses. So yeah, almost everyone have been facing, and especially like you said, the marginalized communities have definitely, especially communities that other people sort of look down upon, and there's a taboo and bias against them. Yeah, they have had to face more for sure.
Yeah, because we're here in Calcutta, West Bengal to be more precise.
Mm,
The LGBTQ community is really working hard to make their ends meet. In terms of
mm,
trying to
mm,
start their own entrepreneurship ever since the lockdown has
yeah,
been lifted, and just going by economically is becoming very difficult. But it's great to see that people are kind of coming forward and changing the conversation, and I really hope it's the
mm,
same in Kerala. Because I feel somewhere that there is this similarity in the way that they face day-to-day challenges in just
mm, mm, mm.
trying to get their livelihoods and
Yeah,
meeting, trying to make their ends meet and just overriding
correct.
the perceptions of people. So yeah,
Mm.
that's it's great to know that there are certain things which are taking place in Kolkata, and really hope we can see whether there could be some form of synergies in that particular community in Kerala as well.
Sorry, there are support groups over here as well. So hopefully, fingers crossed, everything works out in the best interest of them in the groups, the community.
Sure. So, since the lockdown has lifted in India and people are still trying to make sense of what's happened and how prepared they are to deal with the new reality, How do you see soft mind playing a role in the post-lockdown phase, like right now? Because I know you're very busy, and you'd assume that the cases are, the client base is reducing, but apparently there's still this uncertainty looming. So how do you see soft mind playing a role in the post-lockdown phase?
Mm, 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 mm. Apajit, I would say that we are still in the initial stages of it, stages of figuring out what it is, how the lockdown has impacted us, what the so-called unlock situation means, how going back to life, school, work, wearing a mask, maintaining social distancing, all that, what it means and what it's going to mean in the future, what it entails. It's going to take some time for it all to come out and make sense because people keep saying this like this isn't the first pandemic and the world has faced worse before. People keep saying that, but they forget to realize that the last time a pandemic happened, we weren't doing what we are doing right now. We were in the fields, we were doing agriculture, we were in the corporate sector, we weren't working inside a cubicle staring at a computer, we didn't have internet. And so, it will take some time for us to actually really find out how this has impacted us, what this means for us as an individual, what this impact has, how this is going to impact our society. It will take some time because earlier on, before this happened, until like the December of last year, we were in the throes of a capitalist enterprise. We were earning and borrowing money, and we were spending money that we didn't have, buying things that we didn't like to impress people we never liked in the first place. So suddenly we are all, in our homes and figuring out who all. It's often said that an adult has like 4 or 5 people that's really important close to them. So
Mm-hmm.
that includes their spouse, their partner, it, a sibling if they have any, their parents, and 1 or 2 friends at the most. So the rest of all the people that we know are who our friend is, who our family is, and who an acquaintance is. So we are finally figuring out who we can live with and who we cannot live without with. So I think the silver lining would be going forward, we would try and spend more time with the people that matter to us, people that are just there, like a acquaintance who we mistakenly called as a friend. So that's the silver lining I would
That's a
hope.
very
And
philosophical take,
from the
Kevin.
soft mind,
That's a
it is.
pretty
And
it's a pretty philosophical take, like filtering out people who are just going to be with you during the hard times, and like sifting through what's real and what's not psychologically. That's
yeah, and just from the soft mind's perspective, we are just trying to keep on doing it, keep on helping people, keep on providing help through online methods. So that's our go to goal objective right now.
right. So yesterday was World Mental Health Day, um,
Yep.
and in that context, it would worth mentioning again that
Yep.
India has a skills shortage in allied psychological counseling services in general,
Mm,
and more
mm,
so for frontline workers, which adds to the risk of doctors and nurses experiencing psychological issues and failing to sustain
mm,
their emergency shifts.
mm, mm,
So,
mm.
how does SoftMind aim to play a more substantial role in the years to come and keep on supporting the community?
Apajita, we've been offering courses at our hospital. Hospital is also a teaching hospital, so we've been offering courses on psychotherapy, hypnotherapy, and just counseling services. We've been offering it to students pan India, and these courses are accredited by the Ministry of the Central Government, uh, uh, Women and Child Affairs. So we've been doing that, and going forward, we'll be continuing expanding this to ensure that more people have access to it, because one of the issues that people face is the lack of access. And going forward, I don't think brick and mortar Going to an actual clinic, a hospital would be the viable option, especially if this pandemic situation pans out and it takes longer for everything to get back to normal.
Mhm.
Even then, I think it would make sense to do it more online, to have a website which would have a more global outlook in its vision and reach, so that people from all over the world, not just limited to a particular state or a country, but all over can practitioners, both practitioners and clients, people who are willing to offer help and people who want help can converge on this website. So what we are hoping is to build a website like that. We have plans for it, and we are hoping the government would step in at some point in the form of subsidizing or grant, and so the help is we can offer it to more people, because right now the obstacles right now are the costs involved. People still find it difficult to afford therapy in its proper form, and also the language. Even though we are doing it in the English language, this interview, what we hope to do in the coming years is offer a platform where patient, a client rather, can access therapy in the language that they prefer, in the language that they are comfortable in. So it could be Gujarati, it could be Bengali, it could be Malayalam, it could be Odia, I don't know. But
Mhm.
whatever language they are comfortable in,
Mhm.
the practitioner and the client can converse in their native tongue, so as to speak. And so that's what SoftMind's future objectives are: expanding our courses to a more pan-India approach, and also a website and online platform where more people across the globe, irrespective of nationalities and religion, can come in, take help, seek help, get help. So that's the plan.
Well, that sounds fantastic, Kevin. And genuinely thank you for your time. Astrit looks forward to working with Softmind in creating the much needed awareness in the mental health and healing
Yes.
space. And yeah, we look forward to,
Yeah.
converging interests and shared visions. And let's see how far we can go with this idea. Thank you
Yeah.
very much for your time, Kevin. And wishing you and
Thank you,
Amor
Ashad. And yeah.
all the best. Sorry, yes.
No, just thanking Astrid, thanking Apajit, and thanking Mitra, all the people, wonderful people over there for having us, for hosting this meeting, this interview, and thank you, and all the best to you as well.
Thank you.